Good morning. We're going to be starting in just a few moments. We're going to let a few minutes for people to get on. Please enjoy some of the photos that'll be going through of our central region, and we'll start in about 2 to 3 minutes. Welcome, and thank you for attending our third donor town hall. Almost said annual, but we are trying to do these monthly to try to connect to our current donors and to encourage our donors to connect to other generous donors in our community and talk to you about what the work we're doing and how the impact of what you're giving is showing in our day-to-day services of children and families. I want to direct you to the question and answer function in the bottom part of your screen. We really encourage you to ask questions throughout. We will do our very best with this great group of panelists to get to all of your questions. But as if you can see in the top right, we are recording this, and so we will be able to put this on our webpage for you to go back and look in case you have to get off for a few moments, or also we really encourage you to share this with others to learn more about a couple of the services that we're going to highlight here today in the Central Region of Children's Home and Aid. So I have the honor to introduce our President and CEO, Mike Shaver, who's going to kick us off, and we look forward to sharing our programs with you today.
Great. Thank you so very much, Mindy. It is really good to be with everyone today. I just want to extend a welcome to the incredible folks and partners that we have that make all the work we do in the Central Region so successful. So thanks for joining with us. I always learn a lot from this because, of course, as you appreciate the staff that we have doing the work every day, they're really the smart folks. They're out there changing life trajectories, and we're gonna hear from them today. And I know you're gonna find it as rewarding as I do to hear from them. Despite doing this work in a really different environment, like for all of us, the past year has been a different environment in every possible sense of the word. But I want you to know that we just haven't missed a beat as an organization. And during our board meetings, we often underscore that while the world looks really different, how we engage with families, how we maintain those relationships, how we're there at a time where it really matters the most, that really hasn't changed for us. Maybe how we do the work is a little different, but our sites have remained open, and they remain open now. We continue to operate 24/7 crisis response programs, which never stopped. I will say that for a lot of our office-based staff, Children's Home and Aid is still largely remote. We're seeing clients, but we work together as a team remotely. And we do this for a couple of reasons. One, we are not out of the woods on this pandemic. We feel like as community partners, we have an obligation to minimize the kind of exposure of our staff, the kind of exposure to the broader community. So what we do is we have a lot of staff working remotely when they can, but then we have staff in the field observing all the critical safety measures, right? The distancing and wearing of masks. And that's how we continue to operate our program. Now, I want to say none of this work, especially the work that is involved meeting added needs of families, would have been possible without the donors just like those of you joining us today. We have been incredibly fortunate to have the full support of our partners, which has allowed this work to continue. let me just say a couple of things about what's ahead. I do think we have only seen the tip of the iceberg in terms of the real challenges that we think lay ahead for the families we serve. We recognize that the unemployment level, the job losses, the added stresses of having children at home where parents are not only trying to work, they're trying to be parents, they're also having to be school teachers and manage what has always been a priority for parents, the education of their children, but doing that in a very different environment. And those stresses, the added stress and what it means to mental health and just the way in which that can challenge parents to be the best that they can be for their kids, that continues to be a problem. And I think we are slowly climbing up that particular mountain, and we have our work cut out for us. Of course, we will do that and respond to those needs, but we also recognize that we're going to do it in an environment of great fiscal uncertainty for the state of Illinois. Our current fiscal year budget for the state has a $5 billion budget hole in it. The fair tax proposal did not pass. There is not additional revenue. Some efforts to generate additional revenue during the lame duck session were not successful. And so we have already seen an announcement of about $780 million in cuts in state services between now and the end of the fiscal year. It could be higher in the event there's not more relief from the federal government in the form of a stimulus package, but that could make doing this work really difficult as our public sector funders have to begin to prioritize how they're spending their dollars. And of course, that's just the beginning. We are anticipating another $5 billion budget hole in next fiscal year's budget. So I say that not to create a lot of overt concern, but instead just to recognize that the public-private partnership that the work that we do represents, it really does depend on the partners that we have to keep these kinds of services afloat in an environment of great uncertainty for the state. We are committed and we're going to do this. And we have got exactly the right team all across the state, but especially in the central region, bright, talented people who know how to make this work. And I am now happy to turn this back over to one of the best and the brightest, and that's Mindy Smith, our Regional Vice President for the Central Region. Thanks again for joining us.
Thanks. Well, I get to talk a little bit about our panelists that Mike talked about being the brightest, and that also includes our local advisory board too that we're going to talk about in our time together. First, Sarah Duvidak is our Assistant Site Director for our Scott Early Learning Center. She's been with us for 9 years, starting off as a teacher for our Scott Early Learners and has continues to lead us through the last 10 months and beyond at the Learning Center. Jeanne Higdon is our Family Support Program Manager. She is over a variety of our family support programs in the Central Region, including clinical services, home visiting programs, and what she's going to talk about today for us is Crisis Nursery. I believe Jeanne is hitting on 20 years with Children's Home and Aid. She started as a young child, so she has a wealth of experience and a passion for the work that she's going to share with us today. Lisa Sparks is here. She's our local advisory board chair. She's been with us almost 10 years, I think, as a board member, 9 years maybe, and she's going to talk about board engagement and a lot around how the board can get involved for our Central Region staff and for the families we serve. And then Chris McConnell, another advisory board member who's been with us a few years, and will tell his story about how and why he got involved with the board and how Paul Davis is getting involved with him with his membership on the board. So we're excited to hear from all of the great panelists today that can help answer our questions and talk about how the last 10 months have been and where we think we'll be going in the future as well. So we want to welcome all of you and thank you for joining us today. We have a full agenda to share And so we will get right into it with some questions. There might be some people on this webinar that aren't as familiar with the two programs that we're going to be talking about today. So we thought we'd start it off with just kind of talking about what these services are. And Jeanne Higdon's going to start us off with the Crisis Nursery and just an overview of the services, which is not an easy task for either of these programs because day to day is a new adventure, but we'll try to at least give a little bit of an input on what it's like in the Crisis Nursery. Jeanne.
Good morning, everybody. Thank you, Mandy, for that. The Crisis Nursery, for those of you who don't know, is a program that operates 24 hours a day, 7 days a week, and providing care for children whose families are experiencing some state of crisis. The top 3 reasons that somebody would use our nursery typically involves domestic violence, homelessness, or mental health. And, we're in COVID right now, so those needs are increasing and growing every day. Our crisis line is open 24 hours a day. We're there serving our families. It looks different, it looks a little new, but we're still here working with our families.
That's great. And I wanted to mention that there will be pictures that are going throughout while people are speaking to kind of hopefully connect you. We'd love to give everyone here a tour of the facility, but this is hopefully a little bit of insight of what our nursery and our Scott Early Learning Center has looked like in the last 10 months. So wanted to make sure that people knew what was going on the side. Sarah, you want to talk a little bit about the Scott Early Learning Center?
Sure. Hello. So the Scott Early Learning Center is part of the Children's Home and Aid that is licensed through DCFS to serve 154 children. We also maintain a NACCE accreditation, which is the National Association Education of Young Children. And then we're also maintain a gold level status through Illinois, which is a state accreditation program. So those basically just show that we hold and maintain a high level of early childhood education and maintain a commitment to that. Last fiscal year, for example, we served 118 children through 88 families, and less than half of those have an annual income of $25,000 or less. Just for an idea of the families we serve. We also currently hold a Preschool for All grant, which is basically a state-funded program for children ages 3 to 5 and for at-risk youth. So the different risk factors for that program, there's a whole list, but a parent incarcerated, English as a second language, multiple children under the age of 8 in the household, single parent household, and the list goes on. So that program serves 40 children and it's half day, morning and afternoon. So we have a lot of different things. We also just have a full day program for children ages 6 weeks to 5 years. And so those are some of the things that we do here at the Scott Early Learning Center.
That's great. That's where I started a little over 20 years ago as an infant teacher. So that program has really grown in the last 20 years. But have always the thing that started 20 some years ago, I think 1996, I think you said, Sarah, to today is the commitment to quality of teachers and education. So thanks. So the last 10 months have been challenging for us all and for the families that we serve. So Jeanne, do you want to talk about what the last 10 months have looked like for the Crisis Nursery and what are the emerging needs that you've seen from families that have come through the nursery?
Sure. The Crisis Nursery last year served over 300 children and 245 families that came through our doors. And our crisis line doesn't stop. So those calls are coming in. And some of the big things that we're seeing from the families is those need for concrete items such as diapers, wipes, formula. Since shelter in place has started, our Crisis Nursery has given out over 20,000 diapers and 1,200 packages of wipes. We've also been able to give out over 100 boxes of food for families. We couldn't do that without the generous donations and support of our community. I want to just touch on, I have one family that's kind of sticking out in my mind that I'd love to share about who the family has used both our Crisis Nursery as well as our Early Learning Center. And it's a young mom, a single mom who has a 3-year-old who started using our nursery over 2 years ago. And, the little one has some medical needs and mom is just day to day struggling to maintain, to keep up. And through both of our programs, we were able to keep little ones safe, make sure that she had what she needed, as well as help provide rent and utility assistance for mom, not counting, that safe place that we were able to keep little one. Some of the things that we've done differently through COVID is that we were able to work with Paul Davis Restoration on cleaning and sanitizing the nursery and learning how to do that every day. So we're screening the families, we're screening the staff to make sure that we're still providing that quality emergency care in the safest way possible for our programs and families.
That's great, Jeannie. Thank you. Do you want to just talk a little bit about the Crisis Nursery? Did you guys ever have to shut your doors during the pandemic? I know there was obviously a transition time, but what did it look like when we were told that we were shelter in place? How did the Crisis Nursery just initially kind of get through that?
Sure.
Or did you close?
We didn't. Our doors have remained open. We're here. We're serving our families. It took a moment. We had to pause and think, how do we do this safely? But we have not closed our doors. We have been serving families the entire time, through the entire crisis. Now, does it look a little different on the number of children that we're able to have and the needs that we're seeing from the families? Absolutely. But we have, like I mentioned, we've served 301 children and provided 1,645 admissions into our crisis nursery since shelter in place has happened. So that means 1,600 times we opened our doors and welcomed kiddos into our program.
Thanks, Jeannie. Sarah, we've all probably heard a little bit about how we've had to adapt for learning. You want to talk a little bit about how Scott Early Learning Center has kept, through the stages of the last 10 months, learning going for all of our young learners?
Sure. So definitely, like Jeannie said, an adjustment. When we first heard in March, we definitely had to shift our thinking while explaining to parents, they still wanted their children to be safe and keep their routine, but they also were trying to figure out if they could keep their jobs. We started by having grab and goes. That was kind of a first idea that we had, was every other week. So usually on a Friday, but it varied. We would get activity bags together. So the teachers would talk either online, Zoom, or on the phone, depending what the resources the family had. And then we would gather information teachers would to support either a lesson or different things like that. The activity kits, we had things from the community, the Children's Discovery Museum donate. We had diapers and wipes donated as well, and then some food. A couple of our grab and go events provided a meal for the family, so they could come and when they're running out of ideas of things to do at home, we could send them lots of things to do to keep their little ones busy during the week.
That's great. And so you were doing virtual learning then during the initial period. And then after, once the classroom started coming back, what has changed for the center?
Sure.
How did you keep moving?
Yep. So we maintained contact the end of March, the end of July. We opened back up. And then we, working with licensing, different requirements, the classroom sizes have had to be smaller. And then it's looked a little different, having to have 2 adults in the classroom, whereas some before we had some classes with 2 teachers. Now that was a requirement to be able to maintain the higher sanitation levels and expectations. We do drop off and pick up in the parking lot to eliminate adults coming in. To this day, we haven't had parents in, so that's looked a little different with the teachers having to share more pictures of the environment because they can't just come in, but we're doing daily health screens like you would at your doctor, dentist, as well as taking temperatures to make sure that nobody has, is coming in with a symptom. Sorry, to be able to ensure the health and safety of all the children and families.
Yeah, that's great. When I am on campus and my office is right by your door, I get to see the teachers trying to connect with parents outside and have those conversations that normally would have been in the classroom. So thank you. We're going to shift and talk a little bit to our our panelists that are representing our advisory board today, and I think we have some participants that are on the board as well. So thank you for attending. First of all, Lisa, you want to talk about what the role of the board is, and maybe just a little bit about why you joined.
Thank you, Mindy. Yeah, the role of the advisory board is to advocate for Children's Home and Aid. We have a historically very engaged board, and we try to represent the community and the voice of the customer for Children's Home and Aid. And that means we have board members from State Farm, from Country, from Paul Davis Restoration, Weaver's Rental, ISU, Wesleyan, which we are actively trying to expand our reach so that when we go out as our role to advocate and to introduce as many people as we can to Children's Home and Aid, and then in turn encourage donations and through fundraisers and other things, we can do our best in that way.
That's great. Do you want to talk about why you did join, kind of your story of how you came to be a partner with Children's Home and Aid a few years ago?
Sure. I have a friend and work colleague, Paul Van Ness, who in a casual conversation brought it up. And by the way, that happens a lot with board members when we're out in the community. It's easy to talk about Children's Home and Aid, and it piqued my interest, he could tell. So he invited me to a board meeting, and with the enthusiasm in the board and listening to the stories about the clients and the reach we have in making our community stronger, it was easy for me to come on board and join it. As someone looking for a way to give back to the community, it felt like a really important role. So, and fun.
That's great. Thanks, Lisa. Chris, you can obviously just kind of roll right on that about your why and how you got involved with Children's Home and Aid, but then also your connection of Paul Davis and the new relationship that formed due to you being on the board with that as well.
Absolutely. I got started about 4 or 5 years ago by volunteering with a program or a fundraising event called Stuff the Bus. It's a big event that we do every year annually. I started as a volunteer. Then emerged Paul Davis, my company, into sponsoring that event because I wanted to get my staff involved in helping this organization. And that involved into a seat at the board and being able to be an active member with a very exciting board that we have to help continue to advocate and get our mission known out into the general public. So I was honored to be able to be a part of that. I was honored to bring Paul Davis in, and we tried to participate full staff in what we can do to help Children's Home and Aid, whether that is COVID cleaning the nursery or whether that's raising funds to help support the nursery or any other efforts that Children's Home and Aid is in at that time.
Or even including staff dressing in a big baby suit in front of the bus.
That could, whatever it takes, we make sure it happens.
Yeah. So obviously, board participation in events or fundraising has looked different this past 10 months. Chris, you want to talk about how your group of people that have always been a huge supporter of the Stuff the Bus, how did you make that shift in a year where we couldn't have the level of volunteer support?
Sure, absolutely. Stuff the Bus is an event that raises, it collects items for the children's nursery, the Crisis Nursery, diapers, wipes, formula, clothing, anything a child may need. Typically that event has over 100 volunteers helping us collect those items. This year with COVID, it changed dramatically. We had no volunteers. So it was us as staff members and volunteers being able to come in there and help. So it was a lot different. We got more social media involved, radio involved, and then we made it a fun atmosphere on social media of fundraising, and it was very successful. Just had to adapt to the circumstances, and I think we were able to overcome and made it very successful at that time.
That's great. I know the staff greatly appreciated it. Lisa, I know that you're also involved with another place where the board has gotten involved is the Adopt a Family program, the holiday giving program. And I think I saw you wrapping presents there. Do you want to talk about how that was adapted a little bit for Adopt a Family as another example of an event?
Sure. Adopt a Family, as we know, is a large event a big event for us in the community, and it's so beneficial. And this, we had to modify, as you said, Mindy, because usually we invite lots of people to come in and wrap and shop for the families. And this year we couldn't do that. We had to limit the number of people who went in the center to wrap and also to shop. And that put a big strain on a small number of people. But the people that routinely volunteer for this event stepped up tremendously. And as the center required the same things that were talked about earlier as temperature checks and health screening, so that when we went in to volunteer, we could be safe. And also we limited the people to like 6 or 7 people in the center, so that we could minimize any possible exposure. But as I said, everybody stepped up and we were able to help with every family.
That's great. And those are 2 great examples of connections to the Scholarly Learning Center and Crisis Nursery of materials that went directly into families' hands, whether it was for the holiday program or Stuff the Bus, that literally does Stuff the Nursery with resources for the whole year. So families don't have to worry about bringing the things that Jeannie had talked about with diapers, wipes, formula, maybe another set of clothes, all of those things. And so that was definitely an example of local community support, as well as our board stepping up to try to find new ways to connect, to get those resources to the families. And I believe Adopt a Family was a record year of nearly 200 families served for that. So amazing. And I think it was a record year for Stuff the Bus as well for financial support. So we've got a few more questions I want to make sure that we get to before our time is up. Jeannie and Sarah, both, but can you talk a little bit about maybe some lessons learned from COVID? What are we hearing directly from families? And so either something that's been said or possibly a story of a family during this time that appreciated the services. So Sarah, you want to start?
Sure. Sorry. So one thing that we've heard more than once is that we're so appreciated when they're having their kids at home. They realize that it's a challenging job, and so what we've kind of learned is the importance of early learning in the classroom setting and how much they get out of the social emotional interactions. You know, it's not just math and reading. Those things are important. Sorry, but the play aspect is very important here as well. I do have a direct quote from one of our families that appreciated us so much over the pandemic. If I can just read it directly. They said, "The center has always been so generous in giving to us, but especially during the pandemic, from the Zoom calls to the drop-offs and the people always stopping by with gifts and goodies for the kids. We felt so loved and cared for, and really felt the support from the school. Even with them being back in school now, I always feel the love and support every day. I have nothing but amazing things to say about the school and staff who've helped me and my little family so much. We were provided with resources, and it truly helped so much, and I'm forever grateful." So coming in to the house, you know, they would drop off, and it was socially distanced. You know, we could drop it off on the porch, wave to the kids in the windows. So when they did come back, we weren't strangers. You know, they had maintained their relationships the whole time.
Well, that's great. Yeah, seeing some of the pictures that have gone through of the kids' faces light up, those are actually pictures of kids receiving letters, possibly from teachers, or on the screen getting to see their teacher in person through the help of technology. So Sarah, you mentioned just a little bit about social emotional that I just wanted to follow up on. Coming from an infant room teacher, I know how much the face is important to show emotion. So how did the classrooms adapt to some of those things that maybe a mask might have been a struggle?
So, you know, back in March, the mask idea was not as widely accepted as it is right now. And so we're at home and we're emailing and trying to communicate and brainstorm what it's going to look like when we open back up. And one of our infant teachers actually brought up, she'd seen the clear face coverings, the face shields, and are we going to have access to those? She was really worried about the language development of her infants. And now we know those are widely used, but at the time, that was just such a novel idea. I hadn't even thought about it. And so we do use those when it's, reading a story or music time, because that is one of the ways that children learn to speak, and they're watching the movements of your mouth. So we've done that. And then a teacher brought up to me, I was actually frustrated and talking about the mask, and my voice was muffled. And the teachers reminded me that they can tell when you're smiling at them, and the kids are smiling back. So there's something still with the eyes. And so that was an example of a teacher reminding me that the masks are there, but we can still have an emotional connection with the children. So we are making it through.
That's great. It's great. And actually, we're starting to get a couple of questions. So just a reminder, if you have some specific questions you want to answer, to put that in the Q&A. One came up for Jeanne. Have you seen different needs for the families that are using the nursery in the past 10 months? And how have you been able to adapt to that?
Thanks. Yes, we have seen needs. And I just want to start by saying parenting's hard. It's the hardest job I've ever done. And our families are feeling that. And we've seen the calls come into our crisis line increase, just knowing that there's a voice at the other end of that line that answers it 24 hours a day. If I'm in the middle of the night and my little one's not stopping crying, that there's somebody else at the other end of the line that can answer that. But one of the other things that we've seen is the need for those concrete items such as diapers, wipes, formula, and rent and utility assistance has been a significant thing that we've seen our families needing right now. And again, we've only been able to support them because we've had such generous donations from our community, and the Stuff the Bus event was successful, and we were able to give out that number of diapers that I had previously mentioned. But we've learned that, we're here, and that line is important, that our families are resilient, and that we can think creatively on how to best meet their needs. And it takes teamwork among the programs, but I don't think we've had to turn down a family for something that they've needed.
Great, thank you. Somebody had asked about events in the future. What will those look like? And I can just kind of answer a little bit of that we are continuing to look at every event and how we can adapt it to a place that we can still talk about Children's Home and Aid. And that's the main thing of what we do and why it's important. And then second of all is how we can do it safely, obviously, for staff, volunteers, and generous donors as yourself. And so right now, we're still looking at a virtual format, and we're coming up with some virtual, like 5K events. Some are around wellness, some are around fun, but ways that we can still connect to our community. And what we've seen is the donations have been significant of concrete, is what Jeanne spoke about, of diapers, wipes, learning materials for the ELC. But the other thing, obviously, that we want to continue to talk about is the flexibility of when you are able to give financially the dollars, it does provide some flexibility to come up with new things that we hadn't initially had to ever budget for or to ask for donations for. And one big piece is technology. As you can hear, a lot of the things that we're still doing are having to be in remote or an adaptive way. So some of our families' access to internet, access to a cell phone, or to having minutes or data to be able to connect. Those are things that we've never really been asked for in the past to this kind of degree, and that we are continuing to get. Another big piece is around rent and utilities, assistance financially for that, so they don't get so far behind that once they do get back on their job, they can't even catch up. And so I know the nursery has been a very big gateway for families to come and ask for, this is what I need to be able to do what I need to be doing for as a parent or for our family. And so that has been extremely beneficial for when we have got financial assistance from our donors, that we've been able to have the flexibility to be able to do these different types of calls from families, which we haven't always been able to do in the past. Sarah, you talked a little bit about what the center looks like. So you talked a little bit, I just want to kind of touch on of the families that are coming. There's a mixture of families that are, you know, coming from, you said risk factors, but then also families that are paying, you know, that are full pay. Do you want to kind of talk about the rooms, I guess, per se, of what it looks like?
Sure. So, you know, we still have a little stigma in the community. Somebody will call or be referred here by a friend, and they'll call and say, can anybody go there? I didn't know that anybody can go there. And somehow, you know, we've kind of maintained that in the community. So we are trying to work against that. We have children from all different backgrounds. We have several self-pay families where they are seeking out that experience of a real life setting. They appreciate the diversity. They appreciate our focus on social emotional learning and the diversity of our clients, and they want their children to be exposed to that. I will say that since the COVID situation, our DCFS numbers have over doubled. The cases that they're involved with have grown. So we do have, you know, it looks different that way. And that just comes with a different set of challenges. But I call us like a melting pot, and I encourage anybody to look us up on our Facebook page for the Scott Early Learning Center, or call to schedule a tour.
Yeah, once we can, right? We're trying to work on virtual tours and everything else. And when you bring up on DCFS, you're talking about serving foster children, correct?
Foster and intact families, yep.
Intact, yep, great, thank you. Lisa, I don't know if you want to talk a little bit about when we talk about, I mentioned financial fundraising for when we work with our community, either through local businesses or individual donors. And again, no donation is too large or too small. But when that money comes in, does it just kind of talk about staying local, I guess, and how that people can, you know, make sure that stays within programming that they have that interest for, or, you know, in the community, I guess is what I'm trying to spit out.
Sure, Mandy. Yes, as we have fundraising events, or as as donors communicate with us, we can tell them that the money does stay here local. It's for the central region, and we can direct all our donations for the help for our community, so that they're rest assured that what they're contributing actually is going toward making their personal community stronger. And if there's an interest in, like the Scott Early Learning Center or the Crisis Nursery, if I, for instance, have a special interest in supporting that program, yes, donations can be directed specifically to that program.
Great, thank you, Lisa. Jeannie, a couple questions are coming in about the nursery, so that I'd shift to you if you're okay with that. Two different questions you can answer, but Stuff the Bus, did we get as many items as we typically do? Obviously, not as many people are out shopping in person, and if not, are there ways that people can help? And I'll let you answer that first, and then I'll ask the second one, because it kind of goes a different way. So go ahead. Sorry.
Sure. For the Stuff the Bus event this year, it was a success. It was a great success that we had, you know, and some things, items, and some different donations, such as toys and stuff. Those numbers were pretty consistent, but we did receive less formula this year than we had in the past, as well as less actual packages of diapers that we did. It was still successful, but those numbers were a little lower than they had been in the past. And so if somebody was still wanting to make those donations, we absolutely use the nursery is a 24-hour facility, so you can drop those off at the agency. Call us ahead of time and we'll make sure that we come up with a way to drop those off that's safe for everybody. But you can also go online and have items shipped directly to the agency and put attention Crisis Nursery on there. We have Amazon as well as Walmart wish lists that you can go online, and we make it as easy as possible to be able to donate to those, the program.
That's great. That's great. And they can reach out to you directly and get those if not, or we'll have a slide at the end. Laura Cordero is our development associate that can connect people to those sites for sure. Thank you, Jeannie. Another question has come around domestic violence. And I know that you had mentioned that we serve a good proportion of families that have been impacted by violence. Significantly, we know that domestic violence has gone underreported during the last 10 months, and if during shelter in place of families. How have you been able to support those families still? Has it changed, and are you partnering with other community members to help serve families that might be impacted by domestic violence?
That's a great point. Thank you for whoever asked that question or brought that up. We have seen it. We work very closely with our state's attorney's office and our domestic violence unit here in Bloomington. And we do know the numbers are increasing almost at an exponential rate of calls that have come into the domestic violence hotline. And what we're doing is, if we have a family that we know who there's been domestic violence in the past, or they're currently in a relationship that had some red flags, we are actively reaching out to those families to make sure that we're staying in close contact with them, as well as continuing to prioritize them for an admission into our nursery, and making sure that we're making those community referrals to our local domestic violence hotline, our local domestic violence shelter, and those partnerships that we have with the domestic violence unit and the attorneys in town that we work with.
That's great. Do you have a story of a family that you want to share that had benefited from something that you just kind of talked about? And then after that, I've got a question for Mike Shaver that just came through. So.
Sure, I do have one story, and she won't mind me sharing this. She's given permission. We do have a mom with a little one that we have worked with for quite some time now, and a long history of things that have happened in the past, including domestic violence. And we've been able to work with little one for quite some time. And this mom requires chemotherapy every other week, twice a week for a medical condition. And she told us that she knew the nursery would be a safe place for her little one to come to, because we take those extra measures of sanitizing in between each child and family that comes into the nursery, screening our families, as well as she just knew her little one was going to be safe when he was at our program. She was so grateful that the doors didn't close, that we were still there, because her words, not my words, were that she didn't know if she would be alive if we weren't able to help continue to provide care, so she could continue to get that treatment that she needed. It's a life-saving thing for her. And because our doors didn't close, she was able to continue on with that. So again, she asked me to share that and asked me to share her gratitude for the agency allowing the doors to stay open.
Thank you, Jeannie. Thanks. Mike, a question came through here for you. Knowing that COVID has, impacted children of color at higher rates, what is Children's Home and Aid's response going to be to this now? And do you see something, what our response will continue to be in the future?
Yeah, that's a really important question. One of the things that we noted really early in the onset of COVID, in the early part of the summer, was that it really was a double pandemic. There was certainly the health concerns. There was actually a triple pandemic, the health concerns, the economic concerns, and then in particular the impact on communities of color, disproportionately part of the front lines, disproportionately having differentiated access to healthcare. It all underscored for us something that's a big part of what we're talking about internally in the agency, which is having intentional impact with a lens around social and racial equity. It is tough not to look at the impact of COVID and not recognize the elements of historic and institutionalized and systemic racism and the impact on Black and Brown communities. And for us, it's not a political issue. It is simply a question of wanting to have the greatest amount of impact we can in the community. And we know that recognizing those differences and increasing our own capacity to be sensitive to the fact that these are obstacles to families and the children of families to succeeding, we think the only way to do that is to begin to have conversations internally about how this work is affecting communities of color, and that COVID was just the beginning of that, and that as we grow and develop and sharpen our impact as an organization, we're going to have to continue to emphasize and focus on the work, bringing front and center a lens on racial and social equity. So it is an important question, and it's really what the last year has taught us. If that impact is differential, you can imagine how families of color are dealing with this, and that our response not to reflect that and not to require of us more intentionality about addressing those inequities would just miss the mark. It's about it's work that we have to take seriously, because it's the impact we want to have with families, and in doing that, we'll be more successful. So I appreciate the opportunity to address that. Thanks, Mindy.
Thank you, Mike. Thank you. I know that's something that we continue to talk about at our team level, our board level, and in our community efforts as well. So thanks, Mike. I want to encourage any last few questions that people might want to ask. We're going to be wrapping up here in just a few moments. I'd like to ask maybe Chris if he wants to talk about a question around, if I want to help, how can I get involved? What's your input on that?
My input is reach out to any of us. We're happy to answer questions, tell you what our passion is about it, and how to get involved. Laura is a great resource. Jeannie, Mindy, everybody at Children's Home and Aid. Anybody on the board would be willing to help to show you how to get involved. There's many different ways. They're volunteering for events. We're looking for folks to get on the board to help us spread our word of Children's Home and Aid, and hosting any events that may help raise funds for Children's Home and Aid. So please reach out. We're available. We'd love to share our story.
Thank you, Chris. Thanks. And I know we encourage everyone to get connected with us through our social media platform, where we are doing a ton of communicating, as well as our webpage. And like Chris said, reaching out, we'll have a slide here at the end on how to get it directly and connected with myself and with Laura Cordero, our development associate, that can really give you concrete examples of to hear about what your why is, of why you want to be connected with Children's Home and Aid, and talk about our mission and see how those can align, and just ways how you can give your gifts to an organization that's trying to continue to serve our local community. So I'm checking real quick on the right here to make sure we don't have any more questions. We usually end our board meetings with mission moments, hearing directly from either programs or for families. And I'd ask Lisa if she wouldn't mind just kind of sharing a mission moment that maybe spoke to her in the past few months from one of our programs. So she'll close us out, and we'll kind of go from there. So thanks.
I'd love to. We do have, as Mindy said, a mission moment at every board meeting, and we try to, because it's important that the board stay connected to the real life examples of how we're impacting lives at Children's Home and Aid. So there was a mission moment around the Crisis Nursery a while back that stuck with me. A woman who through another program had been introduced to Children's Home and Aid, trusted Children's Home and Aid, and had recently had a baby, second baby, and needed some help with some inpatient postpartum depression treatment. And so she brought her firstborn to the Crisis Nursery because she knew, again, she could trust the staff there, and so that she could get the help she needed, and in turn, in the future, be able to take care of all her family. And had she not had that safety net, they don't know if she would have been able to get that treatment and be a stronger parent as a result. So that really stuck with me.
Thank you, Lisa. Thank you to all of our panelists for being with us today. And most importantly, thank you for everyone who took out the time to listen to us talk about something that we could talk a lot longer than an hour. So I hope we didn't keep you from your next meeting, but we do appreciate your time and we'd love to spend more time with you. So please feel free to reach out to us. And if we did not get your question answered, please, we will look through all of them and get back with this group, but this is recorded again, so it will be on our webpage. Share it, please. And we hope to see you in March for our next donor town hall. And you guys will all be in our list to invite, I promise. And then we also will have a survey that you guys will be able to answer to give us feedback on what worked, what didn't work, as we continue to find out ways that we can connect to our very generous communities that literally help us keep our doors open, as you heard today. So thank you, and hope you enjoy the rest of your day.